Now, there's been public outcry following the revelations that nearly 35,000 patients are waiting for different types of surgeries in Gauteng hospitals. Now, when you look at the reported breakdown, there's a backlog of around 6,700 patients at Steve Biko Hospital. Hani Baragwanath around 6,200, George Mukhari around 5,300, among others. Let's get the very latest now in terms of the figures and where things stand. We speak to Gauteng Health COO, that's Dr. Percy Selepe. Good evening to you, Dr. Selepe, and thank you so much for your time. These figures, right, are reported as at the end of January. What's the latest in terms of the figures?
Yeah, good evening and your listeners. The latest in terms of the updates, we have not yet released that, but those are the figures as at end of January. But what I can highlight is that there's also work that has been done in terms of the month of March and April that currently gives us the number of electives that we've done that are above 25,000 and the number of emergency cases that are above 20,000 in our respective institutions. So there is work that has been done after that. Therefore, once we are done with also collating all the numbers, we can be able to update in terms of what happened in the past 3 months after the initial numbers that were highlighted by our MEC in terms of above 34,000. So what I can highlight for now is that the two sections, which are emergency departments, that we have done above 20,000 cases, and in terms of the elective cases, which then include part of the 34 that has been highlighted, we've done above 25,000.
So would you say then, in light of what I'm hearing you say, as you're breaking down these numbers, I know that you say you still need to tally, but it sounds like you're saying you have actually reduced this backlog. Am I hearing you correctly?
Yes, there is reduction in some areas, but also what we should be cognizant of is that as the Gauteng Department of Health, what happens as we reduce these numbers, there's more patients that are coming on board in terms of seeking the help in terms of most of these surgeries, because my belief is that it's not only the Gauteng Department of Health that has got challenges, but we receive patients from other provinces as well that come within our boundaries to seek help. So those numbers, we still have some of the backlogs, especially in those surgeries that take long. Like if you look at the knee operations that we call arthroplasty and the hips, those they take long, where in terms of the specialists that we have, because also those are done by specialist orthopods, and not all the orthopods are able to participate in that type of a surgery. And one specialist in a arthroplasty can probably do a maximum of 4 patients per day. If we want to say, then we are cognizant of reducing the complications in terms of post-ops and the redos. So we're looking at a maximum of 4 specialists, and we don't have many of those specialists that are capable to do those type of surgeries.
How many do you currently have?
The number of specialists?
Yes.
Well, I wouldn't be able right now to be able to give you the number, because most of these are situated at the academic institutions like Hani Baragwanath, Charlotte Maxeke, Steve Biko, and Dr. George Mukhari.
Yeah.
Most of our regional hospitals, they are predominantly not having specialists that can deal with such cases, although some of our specialists in the regional hospitals are able to do. But also what is critical with that type of a operation, what makes it also more complicated in dealing with them, is that it comes also with age in most of the patients. And those patients have got comorbidities. And as they've got comorbidities, we might, and most of the time, need high care beds before we operate those patients, and
So,
sometimes even ICU beds. And those is also a scarce resource in terms of those beds, because
yeah.
they are also in demand in terms of taking care of our severely ill patients, especially the trauma patients that
So,
come on a daily basis with severe bleeding and other injuries, which then they end up taking that space, even if we have reserved those beds a day before.
now,
So it's a complex situation
yeah.
when it comes to such long, complicated surgeries.
When you speak about that, right, how concerned are you, though, that some of your patients actually die before they get to have this surgery?
We are concerned, but as I've said, that we always, as a department, prioritize those patients that their conditions are acute and severe. And then, I mean, if you look at the rate that we operate, for instance, on the breast cancer patients, our waiting time at the moment, it's within the TTGs that we've set for ourselves, because those are cancer patients. So, for instance, those we prioritize, and those that really, if
Yeah.
you look at the arthroplasty, yes, it's a condition that is severe in terms of
So,
pain, in terms of mobilization as well, because those patients cannot mobilize freely as they want to
Dr.
do.
Selepe,
But also,
you speak about cancer. Please pardon me for coming in there. You speak about cancer, right? But the Citizen newspaper today is reporting that a man who's currently in a Gauteng hospital, who's suffering from skin cancer and is in pain, a great deal of pain, they say, has been told that he may have to wait until 8 months for surgery at the Charlotte Maxege Academic Hospital. And he is saying that he's concerned because his condition is worsening and he may not have as much time. But you're saying you're prioritizing the cancer patients, yet there's this report.
yeah, that I would say, yes, we do prioritize cancer patients. And unfortunately, for that particular patient, I do not have details now, because when we look at cancer patients, we've got variety of modalities that we treat cancer patients. It could be an operation, it could be a medical treatment, which is chemotherapy, it could be radiation therapy. So I would have then to get the details of
Yeah.
that and be able to advise in terms of what are the challenges with that. But in terms of our protocols, we have to prioritize operating cancer patients vis-a-vis any other patient that comes through our shores,
So what?
except those that are acutely ill
Yeah.
in terms of trauma, in terms of head injuries and other procedures like abdominal surgeries that would then not wait for more than 48 hours.
So, just before I let you go, the issue of the high turnover of patients, as you've mentioned, is a lived reality. We've heard about it for years now. And one wonders, though, because it's still concerning for a lot of Gauteng residents who are worried about their own family members who could be waiting for surgery, who may pass on before they get it. What do you say to members of the public watching us right now who have members of their families waiting for critical surgery?
Yeah, what I would say to those families is that as a Gauteng Department of Health and Wellness, we are worried as well. And we are trying to come up with measures in terms of ensuring that we reach to each and every Gauteng resident who need our services on time and within the stipulated time treatment guarantees that are supposed to be there. That's why in terms of what we do, we also partner now with private service providers. As we speak now, in terms of the cataracts, we've got private service providers that we work with so that we are able to reduce the waiting list in the cataract surgery.
All right.
But also what we are doing as a department, we are trying to review and see and work with all the specialists within the Gauteng Department of Health so that we come up with a plan that would be able to service our patients even at a lower level. Because currently what is happening, most of these operations are done at a higher level. But now we have specialists like if Charlotte Maxeke now trying to utilize hospitals like Backlog Hospital, where specialists from Charlotte Maxeke move and start operating at Backlog so that therefore patients, there is a spread and there's availability of resources
All right.
that then we are able to take the service to the ground and to the people.
Dr. Selepe, we'll catch up with you then when you've managed to then put the numbers together so we get a tally as to how much of a dent has been made to this backlog. And as you say, that the high turnover of patients, because you now do have patients that are presenting themselves in case of emergency as well, further complicating the picture. But thank you so much for speaking to us this evening. Appreciate your time. That was the Gauteng Health COO, Dr. Percy Selepe.